Thank you, Senator Singh. Senator Di Natale.
Thank you, Mr President. In December last year, I visited the countries of Liberia and Sierra Leone to monitor the international response to the Ebola epidemic. As a former doctor who's worked in international public health and now as a federal senator with a platform that I think few others enjoy, I had a responsibility to bear witness to what was going on in West Africa. It was an opportunity to listen to people's stories, to better understand the outbreak, and to identify areas where Australia might better contribute. Ultimately, I felt compelled to visit, largely because of Australia's inaction and a feeling of wanting to do more. I reflect on that experience with mixed feelings. There's a deep sadness that comes from watching an orphaned infant in isolation being comforted by someone in a protective suit, from hearing the wailing of a grieving woman who's watching a burial team carry away a loved one in an orange body bag, or from seeing young kids playing, knowing that they're part of the 10,000 orphans who've lost their parents to this terrible disease. But there were some uplifting moments too, like the courage of the West African people at the front line of this effort. Like the West African hygienists, they're the people who are responsible for cleaning down the vomit, the other wastes, disposing of all the infectious material and decontaminating and removing dead bodies from treatment centres. Or the midwives at Liberia's largest hospital who continued to deliver babies right through the peak of the epidemic while doctors around them died. When you think that Ebola is transmitted through exposure to body fluids, these are people who are working some of the most dangerous jobs on earth. We've now seen over 22,500 cases of Ebola. We've seen 9,000 people who have died. But that headline figure doesn't do justice to the profound and far-reaching impact of this disease. You've got countries that rank right near the bottom of the Human Development Index, some of the poorest countries on earth, on the back of civil wars where Ebola's wrought havoc across the health and education sector. Now, in each country, the health system was barely functioning before it, but it's now near total collapse. You've got hospitals in both countries that are either closed or barely functioning. There's been a number of doctors who have died. In fact, some of the most senior doctors in the biggest hospital in Monrovia in Liberia have died as a result of Ebola. And not only have they lost doctors, they've lost a mentor and doctors who are responsible for training the next generation. So it's a double blow. It's had an impact on the health system more broadly. When you consider that Sierra Leone, for example, has the highest under-5 mortality rate in the world, we're now seeing childhood immunisation rates plummet even further. So a number of people are now dying as a result of the impact on Ebola on the health system. And while they won't be counted in the official death toll, they are directly attributable to this outbreak. And in education, things are just as grim. Schools and universities completely shut down. The school buildings were used as holding centres. Many of the kids who were going to school have now started working. They'll be lost to the school system for good. We spoke to NGO workers who tell us that a whole generation of young kids now lost completely to the education system. And on the economy, the World Bank estimate that the impact on the three most badly affected countries, Liberia, Sierra Leone and Guinea, will lose $1.6 billion in foregone economic growth in 2015. Now, we are making some progress. Most of the progress is a consequence not just of the treatment that's being provided, but of the huge public health effort that's happening. We've got workers and volunteers educating people about transmission, identifying new cases, tracing contacts and restricting the spread of the disease. But one of the challenges is that it's a disease that's spread through love, through human contact. The people who are most at risk are the parents or siblings of who are looking after somebody dying from this disease. And the instinct to want to reach out, to care for, to console, indeed to clean somebody who is vomiting or is suffering severe symptoms from this, it's very hard to resist. Imagine having a loved one who's sick or ill and not being able to engage in any physical contact with that person. That is why it's such a challenging disease. And of course the impact on those people who do survive is also traumatic. When you consider that half of the people who are infected will survive, many of them return to their communities, but they're often shunned because there's a sense that they might infect others, which is a sad irony because they're people who are now immune to the disease and could be used in helping, who could be used to help combat the spread of the illness. So it's a cruel double blow. And now we're seeing signs of post-traumatic stress disorder on survivors, on carers and on health workers. It was really great to see the many, many Australians in the field who are making a contribution to the fight against Ebola. We've got Australians working at every level, some of them who head global organisations like the World Health Organisation, UNICEF and others. They're leading the charge working with NGOs. Many of them are on the front line themselves. They're doctors, they're nurses, they're logisticians, and they're providing healthcare in very high-risk settings. And it was really inspiring to see the work that they're doing. But it must be said that the Australian government's not flavour of the month in West Africa at the moment. I was shocked. I was shocked at how many people actually noticed that some of the things that our government had done and hadn't done. The thing that raised the ire of most people was Australia's unilateral decision to impose travel restrictions that do nothing to protect people from Ebola. They don't improve people's safety. They don't contain the spread of the disease. All that they do is spread fear and information about the disease. And I remember speaking to an aid worker who was really frustrated by the announcement around travel restrictions. And he told me that it was the first time after 20 years of aid work that he hasn't felt welcome returning home from a mission. It's true that Australia did make a small and reluctant contribution by awarding Aspen Medical a contract to staff a treatment facility. Now, I have expressed concerns about how that contract was awarded, and I was grateful to be offered a tour of the facility. I met with the operations manager there, Daniel Kerr, and it must be said that the work they were doing was of a high standard, that the training they were offering to their team, and I met with the training facilities there, again was of a high standard. They were doing all the right things in the lead up to opening up that training centre. But the danger is that with Ebola now almost absent from the headlines, there's a perception that things are under control and that we don't have to do any more. But there's a note of caution here. This was the first week where we've actually seen an increase in the number of cases for this year, with 124 new confirmed cases reported in the week to the 1st of February. What's most disappointing is all this is preventable, and when you see what the UK government, for example, are doing, it's hard not to be impressed by their work and to feel that Australia's reputation for responding early to disasters with significant humanitarian assistance now being undermined. I don't know how you can fathom a cut in the aid budget when you bear witness to what is happening in West Africa. It's not a natural disaster. It's a disease that's fostered by poverty, through the lack of water, sanitation and access to healthcare. Now, we haven't been there during the crisis, but we can step up and make an impact in rebuilding the country. We need to commit more financial resources, more technical expertise and commit to the long-term development assistance. And one thing we could do is to support Oxfam's call for a multi-million-dollar post-Ebola Marshall Plan to put the 3 West African countries hit by the crisis back on their feet. But if we've got to do this, we have to recognise these are people just like you and me. We share a common humanity. Their lives are no less important. Look, in concluding, I'd like to thank some of the people who were of tremendous assistance during this visit. I'd like to thank George Wisner, who is from the National Investment Commission, who accompanied me during my time in Liberia, many other officials, the Vice President of Liberia for meeting with me, members of the Red Cross burial team for showing me around, people like the Liberian Minister for Health, Tolbert Nyenswa, who gave me the honour of chairing a meeting of all the major agencies involved, and the many Australians working there, Ian Norton, Anthony Stewart, who helped me in my visit.
Senator Di Natale. The time for your contribution has expired. Senator